Hi everyone, welcome back to my channel Dr. Shahan's class, and here in this video I will teach you about Refsum disease. Refsum disease is very important from the NEET PG point of view and also for the FMG examination and also for the next examination. So what is this Refsum disease? Look at the slide. This is a disease which is associated with impaired oxidation of phytanic acid. So in this disease there is impaired oxidation of phytanic acid. So alpha oxidation of phytanic acid, a kind of fat that does not occur, and this disease occurs. This disease, Refsum disease, was discovered by a Norwegian neurologist. His name was Refsum, and from that we came to know about Refsum disease. Basically, what he studied the level of the phytanic acid, and he found out that in these people who have the Refsum disease, they have a large amount of phytanic acid in their blood. Now, look at this slide. What is this Refsum disease? Refsum disease is also known as adult Refsum disease. Refsum disease, also known as, another name of Refsum disease is adult Refsum disease. It is a metabolic disorder. Remember what kind of disorder? Metabolic disorder, which impacts the pathway of the breaking down of the phytanic acid. So this phytanic acid, which is present in certain kind of food like milk, like meat, all these contains phytanic acid, and there is a pathway in which this is broken down, but this is disrupted in Refsum disease, and so you get so many problem. Look at this pathway. This is actually the pathway by which the phytanic acid, which is broken down inside our body. Now, what is this phytanic acid? Let me give you an idea. Phytanic acid is a kind of fat. It is a kind of fat which is present in certain food items like milk, like meat, and inside the peroxisome this is broken down. Okay, and with the help of a particular enzyme it is broken down, that is known as alpha oxidation of phytanic acid. You remember alpha oxidation of phytanic acid. Now this does not occur here in Refsum disease, and that is why you get the disease. Now, how can you diagnose this disease? Basically, Refsum disease has certain symptoms like eyesight problem. What is the problem in the eyesight? The person has impaired eyesight. What is the problem? The problem is retinitis pigmentosa. Remember RP, retinitis pigmentosa is the problem. And also loss in smell. These people have anosmia. What is anosmia? Loss in smell. Anosmia, loss in smell, along with deafness. All these are there. And if you do the blood test, you will find that phytanic acid level is increased in this patient. If you do the blood test, you will find phytanic acid level is increased in this patient. So you will understand these people are having the Refsum disease. So let us learn about the definition of Refsum disease. See, Refsum disease is a autosomal recessive disorder. Remember, it is a autosomal recessive disorder. Autosomal recessive disorder. And it is a neurological condition. So most of the patient will come in the neurology department. Okay, Refsum disease is a neurological disease which occurs due to the result in over accumulation of phytanic acid in cells and tissue. Remember, phytanic acid. All these are question. Autosomal recessive is a question. Neurological disorder is a question. Phytanic acid is a question. And it was discovered by the scientist. He was a Norwegian neurologist. He was named Sigvald Bernhard Refsum, and Refsum disease can be also known as adult Refsum disease. Remember, another name. Now look at this slide. This is showing the prognosis. How can I live with this disease? Prognosis means how can I live with this disease? Basically, Refsum disease is treatable, but it is not curable. You cannot cure the disease, completely eliminate the disease. You cannot, because there is a problem in the genetic level. So Refsum disease is treatable, but it is not curable. Phytanic acid is found in the food. Phytanic acid is found in which food? Like dairy products and meat products. Dairy products and meat products, like milk and meat. Remember the 2M, milk and meat. You should not taking the milk and the meat. If you avoid this, phytanic acid will not come inside your body, and the problem is solved. Because if there is phytanic acid in your body, it will cause a lot of problem. Like one of the problem is retinitis pigmentosa. You can see the picture. This picture is showing the retinitis pigmentosa. This is one of the symptom of Refsum disease, and this is a question. It came in NEET PG. So retinitis pigmentosa is a feature of which of the following disease? This was the question. Retinitis pigmentosa is a feature of which of the following disease? And there were so many options, the other options, and among that there was Refsum disease. Refsum disease will be the answer. So retinitis pigmentosa, Refsum disease. You can remember R for retinitis pigmentosa, R for Refsum disease. R for retinitis pigmentosa, R for Refsum disease. Refsum disease is also associated with some bony deformities. You can see the picture. This is the picture showing some bony deformities of the toes. You can see. This is one of the feature of Refsum disease. Look at this slide. What it is teaching? Refsum disease is a genetic defect. There is a genetic defect. Peroximal enzyme phytanoyl CoA alpha hydroxylase. So what is the enzyme that is lacking? Phytanoyl CoA alpha hydroxylase. Phytanoyl CoA alpha hydroxylase. Now what is the process that is disrupted? Alpha hydroxylation. Remember I told you alpha hydroxylation. Alpha hydroxylation is the process that is disrupted. And what is the enzyme? Remember, phytanoyl CoA alpha hydroxylase. What is the gene? PAHX gene. So all these you can remember. Along with remember the inheritance, autosomal recessive disorder. It is a autosomal recessive disorder. Now what are the clinical findings? I have put this slide again because I want to describe the clinical findings. What are the clinical findings? Number 1 is retinitis pigmentosa. Number 2, anosmia. I already told you, that is loss of smell. Number 3, peripheral neuropathy. Number 4, loss of hearing. That is deafness. Number 5 is bony abnormalities. Remember these things: retinitis pigmentosa, anosmia, loss of smell, peripheral neuropathy, loss of hearing, and bony abnormalities. Now look at this case. This is a case of 29 years old female patient who presented with ataxia. Ataxia is also present in this disease. Okay, I forgot to tell you, ataxia since 2 months, night blindness since childhood. This is due to retinitis pigmentosa. You can see the picture of the fundus, the black particles. You can see it is actually representing the retinitis pigmentosa. Bilateral nystagmus and also hearing loss. I told you about deafness is there. IQ is 77. And look at the skin. The skin changes. Ichthysis, that is also due to Which disease? All these are due to which disease? Ataxia, night blindness, retinitis pigmentosa, nystagmus, hearing loss, and ecthymus. So these are due to which disease? Refsum disease. Refsum disease. Now look at this slide. This slide is actually showing the two things together. One is the retinitis pigmentosa on the left side. On the right side, the bony abnormalities. So if there is a picture of these two together, that is a Refsum disease. So remember, retinitis pigmentosa along with bony deformities. Retinitis pigmentosa, bony deformities, specifically they will show the toes. That is actually showing the Refsum disease. Remember, Refsum disease. Look at this slide. Left side, it is showing the normal ocular cell. Normal ocular cell, the phytanic acid in the peroxisome, what is happening? Phytanic acid is converted into phytanoyl CoA, and then it is converted into medium chain fatty acid and transferred to the mitochondria. But right side you see mutated ocular cell. In mutated ocular cell, phytanic acid is converted into phytanoyl CoA, but the next step requires phytanoyl CoA hydroxylase. That is not there. Okay, phytanoyl CoA hydroxylase, that enzyme is lacking, and that is why you get the Refsum disease. So this is me. This is the end of this video. If you like this video, make a thumbs up and please subscribe this channel. This channel is for the medical student. If you are a first year, second year, third year, fourth year, or if you are an FMG, IMG, whatever you are, please subscribe this channel. This channel is a specialized channel on different diseases. I have described so many diseases in this channel. Please subscribe this channel. Have a nice day. Bye bye.